welcome. And I think we're all good to go. So what I'm going to do a little bit is obviously with COVID vaccination, there's a lot of we're making vaccine history, and and from when this whole thing started, we kind of knew this was going to be part of vaccine history. And I think one of the things that we're seeing right now is we're seeing a lot of debate about vaccines and vaccine mandates. And I just thought it would be interesting to kind of go back and talk about how, while we're having these issues, a lot of these issues are things that we've seen really throughout the history of our country. So for those of you who don't know me, my name is Andy Pasternak. I'm a family practice doc with Silver Sage Center for Family Medicine. I'm also the chair for the Immunization Advocacy Committee for Immunize Nevada, and I'm currently president-elect of the Nevada State Medical Association. So again, this is kind of a topic that's near and dear to my heart, so I kind of hope you enjoy it. We'll kind of go through some slides, probably for about 30 to 40 minutes, and then we'll leave some time for some questions at the end here. So everybody knows who this guy is, George Washington. And we're going to talk about him being the first American vaccinator. We hear a lot of talk right now about liberty and freedom and all these things. And I think one of the things that I've been trying to get across to people is really the advent of vaccines really started with our country. And we'll talk about how George was kind of critical with that in a few minutes here. But let's first go back. So for you medical historians out here, this is Edward Jenner, sort of the first person to really kind of come up with vaccines. And obviously when vaccines came out, there was a lot of public health issues with it. So as many of you know, really one of the most devastating diseases that we used to have was a disease called smallpox. It was basically due to the variola virus. We had smallpox major and smallpox minor. It was droplet spread, usually within 6 feet. So very, very similar to what we're seeing with COVID, that, where that 6 foot radius comes from because of droplets. And the R naught, or sort of the number of people on average that you would get sick with smallpox if you had smallpox, was around 3. Obviously with the Delta variant, we're now seeing it, that number is kind of going up and much, much higher. The big thing with smallpox is risk of dying was really, really high. Anywhere from 10 to 30% of people would die from it. If you did survive it, you would have severe scarring, blindness. And it was really an old virus, went back to Egyptian mummies. The amount of dead was absolutely devastating. During the 20th century, they estimated 300 million deaths. In 18th century Europe, 400,000 people a year would die of smallpox. So this is smallpox. This is actually 2 brothers. One of them had been vaccinated. The other one had not been vaccinated. And you can see the devastating effects of when people would get a rip-roaring case of smallpox. So obviously it was a devastating disease. So going back into, and this was hitting countries all over the place. So actually in China in the 15th century, one of the rulers there had a number of family members who was affected, and really was like, what can we do to change this? What can we do to affect this? And what they started doing is the medical folks there noticed that, well, maybe if we took scabs from people, we could expose other people to those scabs, which was essentially the virus. And so this was essentially a way of sort of doing a live virus vaccine. And what they would do is they'd grind these up. Boys would sniff these in their right nostril. Girls would sniff them in their left nostril. And essentially they were using a live virus to sort of create some immunity in people, which did seem to help out. Obviously, with it being a live virus, some people would get sick from this. And this was actually reported in the 1700s. Some of the physicians from England who were in China reported this back to London, but it really didn't go anywhere. Fast forward a few years, and we had this woman, Mary Wortley Montagu, and she was the wife of the British ambassador, and she was living in Turkey and the Ottoman Empire. And at this point, this process of variolation came into effect. And her brother had died of smallpox in 1713. She had some facial scarring, and she saw what the medical people were doing in this area. And essentially what they would do is make a cut, a small cut in the arm, and sort of introduce the virus that way. So in 1718, she's there. She has her son inoculated. And then she's back in England in 1721. One of the doctors that she was with, there was an outbreak in England, and this Dr. Charles Maitland had seen what they were doing, and they said, "Hey, let's try this." So she gets her other son vaccinated, and then they had this is so against what we do these days with human subjects research, but there were 7 prisoners. And they were in for the death penalty. They said, "Okay, we'll let you out of the death penalty if you get inoculated." They all got inoculated. They all lived. That wouldn't happen now. But that was how they did research back then. And so it really kind of took hold. Some of the royal families in England and Russia started doing it. In 1768, Catherine the Great of Russia inoculates herself. And again, this was a live virus. So we talked about smallpox having a risk of death of 10 to 30%. This still had about a 2% risk of death. Well, back in the US of A, we have George Washington. Here's a little different photo of him. And he had contracted smallpox at age 19. He was in Barbados, and he had actually written, they were going on a trip to visit some people, and he actually wrote, he's like, "I don't have a good feeling about this. There's smallpox happening there. I really don't want to go," but they went anyhow. He got smallpox. And then in 1775 to 1782, the U.S. had a huge smallpox pandemic. And part of the issue was we had people in our country who had, the Europeans had grown up with smallpox. Smallpox was more endemic. So there was a little bit more natural immunity there. In the United States, we had a lot of people where it wasn't exposed. Smallpox came in, and so there was much more of a pandemic. 1775, there was a huge outbreak in Boston. There was an incredibly strict quarantine of soldiers and civilians. And actually in that same year in December, the Continental Army was up in the Battle of Quebec, and they were coming back, and smallpox just kind of literally decimated their troops. It was actually far more devastating to the troops than the actual battles were. So fast forward a couple years later, February 5th, 1777, Washington writes to Hancock and said, basically like, "I'm worried. Our troops, if we get smallpox and the British find out about it, and our troops are decimated due to smallpox, we're going to be vulnerable. People are going to be able to attack us." And so he said, I'm going to have this Dr. Shippen start inoculating the recruits as fast as they can come into Philadelphia. So this was really the first mandate of a vaccine really in the world, because, well, again, Washington really knew that we had to do this to preserve our army and our defenses in our very young country, because we were vulnerable. So this was variolation. Again, we fast forward a few more years. So now we're in 1796, and we're back to Edward Jenner. So Edward Jenner basically made the observation that, and he wasn't the first one, but they made the observation that milkmaids, the women who were milking the cows, wouldn't get smallpox. And there was a lot of discussion of like why that was, what we were seeing. And the theory was really that this virus that the cows would get, this cowpox pus, maybe there was something to that would cross over. So in essence, what this really was is they were using one virus, sort of a virus that wouldn't get us sick, to protect us against smallpox. So he basically, at that point, there was James Phipps, was a little 8-year-old. There was one of the nursemaids, Sarah Nelms, who was a milkmaid. She caught it from the cow She got cowpox from the cow Blossom. So Jenner took that, inoculated James, and James did fine. Never got smallpox. If you go to visit Jenner's museum in England, you can actually see the horn of the cow. And this is actually where we get the term vaccine. Latin for cow is vacca. This is where we get the term vaccination from. So a few years later, he publishes 23 cases. He had vaccinated his 11-month-old son. and people started saying, "Hey, yeah, there's something to this. If we give people this cowpox virus, they won't get smallpox." 1840, the British government says, "Hey, let's start vaccinating people," and the Spanish government said, "Hey, we need to start vaccinating people all over the globe," which I thought was very forward thinking of the Spanish government at that point. And it even got to the point Napoleon, similar to Washington, he knew how devastating smallpox could be to his troops. So during this is actually when the French are battling with the English. Napoleon vaccinates all of his troops. He's battling with the English, but he actually gives Jenner a medal, a British physician. He gives the other side a medal and actually releases 2 British prisoners. So even Napoleon was like, "Hey, there's something really to this." So again, we sort of test the idea. By 1805, Italy says, "Hey, we think this is a good idea. We want to make this compulsory." They really didn't have a good way of rolling it out. But in London by 1820, so 24 years after the vaccinations first come out, London starts seeing smallpox deaths, and there's now more thoughts of, okay, how can we make it? What can we do to encourage it? 1840, the British government says, "Hey, we're going to make vaccinations free to people," and then by 1853, he basically said, "We're going to make this compulsory for kids in their first 3 years of life." And then they made it compulsory for all kids below age by 1867. Well, when you make things mandatory, this is where you get pushback. And so a couple years later, in the town of Leicester, the Anti-Vaccination League was founded in England, and massive protests a couple years later. And they basically started to come up with, well, we need some causes. We want some bypasses for this. We don't want everybody to get vaccinated. So as soon as there were these mandates, you automatically saw this pushback. There was a nice little presentation where they basically said, a lot of the arguments you were hearing today, that these vaccination acts trample upon our rights to do what we want. And that Parliament, should be guarding the liberty, and now they're sort of coming in and affecting us and affecting our liberty. And here are some of the, again, graphics, cartoons. This is some of the anti-vaccination things that were. So 1802, they were talking about some of these horrible side effects that people would get from these cowpox. So you see some of the grotesque caricatures here of some of these, what people thought the vaccinations were doing to people. This is one. If you look, there's kind of, this cow and this kraken and all these, feeding babies to this horrible animal that they considered vaccination. Death always sells, especially if you're in the anti-vaccination thing. So they would have, these were ads that were taken out of, how if you vaccinated your child, it would cause them to die. You could even get postage or letter. This is a stationery, sort of promoting how vaccinations were killing small children. Money's always a big thing. This is one of my favorites. Vaccinate. 20,000 victims will be vaccinated. This is going to put $10,000 into the pockets of the medical profession. So this idea that physicians are doing this, the medical establishment's doing this to make money and not to save lives. So this is actually a cartoon, sort of going the opposite way. It's kind of hard to read the print, but it's Jenner and a few other people sort of chasing away the anti-vaccinators, sort of saying, hey, there's good science behind this. If you read the small print, and just sort of like, this is actually helping people. So again, Leicester, England, huge vaccination issues. There was actually prosecutions. Over 6,000 people were prosecuted. Again, they had this huge march. They had a child's coffin during the march. They had an effigy of Jenner. And obviously, one of the things that happened at that point, obviously their vaccination rates went down. Soon after that, their cases went up. Canada had similar issues. 1885, there was a train conductor introduced smallpox into Montreal accidentally. They started mandatory vaccinations, and soon after that, they actually had riots breaking out in Canada. This is actually Toronto in 1918, talking about compulsory vaccinations, down with compulsion. A lot of the same protests that we're kind of seeing today. So in the United States, 1879, there was a British anti-vaccinator that came to visit who said, "Hey, you guys should start doing this. Start protesting these vaccinations." So New England had a anti-compulsory vaccination league. 1885, New York develops one. And really what started things huge was in Cambridge, Massachusetts, our fair city, enacted mandatory vaccination laws. And right after the vaccination laws, this gentleman Jacobson said, "I don't want to get vaccinated. I'm taking this to court. We have liberties in the United States." Went to court, went up to the courts, and in 1905, the Supreme Court case got this. And what the Supreme Court said is, nope, the government can mandate people getting vaccinated. So in their ruling, I'll read it out because I think it's really important. "The liberty secured by the Constitution of the United States does not import an absolute right in each person to be at all times and in all circumstances wholly free from restraint, nor is it an element in such liberty that one person or a minority of persons residing in any community and enjoying the benefits of its local government should have the power to dominate the majority when supported in their action by the authority of the state. It is within the police power of a state to enact a compulsory vaccination law, and it is for the legislature and not the courts to determine." So they really came out and said, yes, if the government says we think this is good for public health, we think this is a good idea, that we feel that this is constitutional. So that was obviously a lot about smallpox. With other vaccines, we haven't seen quite as much. With the polio vaccine, I think everyone realizes it was huge. This is some news clippings from when the polio vaccines first came out. Obviously, people were so scared of polio over the years and how devastating it was. The photo of the upper left of a guy in a artificial or iron lung, seeing the effects of, hey, that you can be vaccinated against this now are pretty impressive. The photo on the bottom right is that's Rackham Auditorium at the University of Michigan. And that's where they actually announced that the vaccinations were safe and effective. The group that was sort of overseeing the trials was at the University of Michigan, and that's where they had the announcement. If you go there, there's a plaque and some information there. So I was back there and I had to take a photo there. But there were some naysayers. There was a famous radio guy, Walter Winchell. He used to have the catchphrase, "Ladies and gentlemen, and all the ships at sea." He's kind of one of the first tabloid radio kind of people, gossipy kind of people. And he actually went out and told people like, "Oh, we think the polio vaccine's killing children and in some of the treatment trials." Fortunately, he was in the minority. He got really kind of beat up in the press, and this was sort of at the tail end of his career where people kind of said, yeah, he's just looking for ratings. But there were some other naysayers like that. And with polio, obviously, when young kids were getting vaccinated, but there was some hesitancy, even in some of the older kids, some of the teenager kids, until Elvis got vaccinated. So one of the more famous things that happened was Elvis was on the Ed Sullivan Show, the biggest TV show at the time. And Elvis got in there and got his polio vaccine. And as soon as he did that, a lot of that vaccine hesitancy went away. A lot of the teenagers who were nervous about the polio vaccine lined up because they all wanted to be like Elvis. So one of the things I always tell people is vaccine trust irrational. And the answer is not necessarily. With smallpox, there was a lot of reasons to be skeptical about the smallpox vaccine. This variolation was, basically you were cutting a little chunk in the arm. A lot of differences in how it was done. There was no standardization. You can imagine, the cross-contamination with blood products back then. There weren't, people weren't wearing gloves. So you might be, vaccinated against smallpox, but you could pick up, some form of hepatitis or other bloodborne disease. There wasn't standardized training. Medical school and physicians were very, very different back then. And again, some of the physicians were going beyond what they should have been doing. It was kind of a simple thing to do, but some of the physicians would make bigger gashes or put more and more stuff in there. So there was a lot of reasons to be sort of critical of smallpox variolation and even the vaccinations when they came out initially. Obviously, a big thing, one of the things we've done with COVID vaccination is we've talked to people and we've done some talks in some of the Black churches in Reno, and Tuskegee always comes up. And for those of you who don't know Tuskegee, you should. If Tuskegee there was basically a public health quote study that was done on syphilis. 399 Black men with syphilis, 201 without the disease. The experiment started in 1932, and sort of what they wanted to do is to see what the natural history of syphilis was. Well, in 1943, it came out that, hey, penicillin treats syphilis. It's still the treatment for syphilis. But unfortunately, none of these men were offered treatment. So 29 years later, finally, the Associated Press basically found out, there was this group of men down in Tuskegee with syphilis, and they're basically being watched and not being offered adequate treatment. Huge story. Completely changed how we do research in our country appropriately. We had, most of the stats say only 7 men directly died of syphilis, but 150 men died of some form of heart failure. So we think that the number of men who died from this was much, much higher. And when you talk to the Black communities, this is something that still really resonates. 1972 is not that long ago. And so when people talk about being hesitant about trusting public health, about trusting research, these are the kind of things that can kind of promote some of that distrust. And then another big one was the Cutter incident. So after the polio vaccine, basically the polio vaccine was announced to be safe and effective in April of 1955. A couple weeks later, reports started coming out about vaccinated kids developing paralysis. And what they found was, it was interesting, the polio didn't hit them in the legs like polio did, but it would hit them in the arm that was vaccinated. And again, what they found out really quickly was there was one lab in California, Cutter Labs, that was manufacturing the Salk vaccine, but they didn't inactivate the virus properly. So instead of giving an inactivated virus, they gave an active virus. So 200,000 kids got this vaccine. There were 40,000 cases of polio and 10 deaths. So it wasn't the vaccine that was unsafe, it was the manufacturing that was unsafe. So again, a lot of people have been concerned about that. And interestingly, it kind of opened the door for, there was a rival vaccine, the Sabin vaccine, which is an oral polio vaccine, which in some ways wasn't as safe. That's why we've gone back to the Salk vaccine. But that Cutter incident kind of opened the door for that. So those were kind of legitimate concerns. And now obviously there's been some less legitimate concerns. 1982, NBC had a thing about the tetanus, diphtheria tetanus vaccine called Vaccine Roulette that tied the pertussis vaccine to seizures. Most people said it was sort of blown out of proportion. They were kind of doing it to get ratings. And then obviously a lot of the stuff with Andrew Wakefield with his MMR autism article that got published in Lancet, that created an uproar. Obviously, that's been kind of discredited. But again, there's still a lot of belief in some of the stuff that Wakefield said. So obviously, with COVID, for those of us who have been doing vaccines, we kind of knew there were going to be 3 challenges. The first was to get a vaccine developed as possible. The next was going to be to try to get as much made and distributed as quickly as possible. And then we kind of knew probably the biggest hurdle of the 3 was going to be the last one, and that was going to be to overcome vaccine hesitancy and anti-vaccination sentiment. So we all know COVID vaccines came out within a year. Medical history, we're going to be talking about this for a long, long time in the development of these mRNA vaccines. We know that they work. We know they're effective. I got my T-shirt on today with these graphs. Vaccine rollout, United States did a really pretty good job. We got a lot of vaccine manufactured. We rolled it out. but we're now at this point with vaccine hesitancy and anti-vax and some of the anti-vaccination. So I do sort of, one of the things I try to do as a primary care doc is try to figure out where my patients are at. And vaccine hesitancy, the World Health Organization kind of says we sort of define that as a delay in the acceptance, or refusal of safe vaccines despite the availability. And then you have the anti-vaccination folks who are just sort of 100% against vaccines. These are people who feel that vaccines are unsafe, they infringe on their rights. And there was a Lancet article that came out that said there's about 31 million people on various anti-vaccination sites looking at some of the anti-vaccination information. There's a good article that came out in May in the New York Times, and they did sort of talk about, at that point a couple months ago, or what are some of the reasons why people aren't getting vaccinated. So there was a group back then, about 8% of the folks were just kind of watchful. They kind of wanted to see what happened with the vaccines. Were they safe? There was what we called a cost anxious group, where they were like, I don't want to take time off work. I can't go somewhere. If you bring the vaccine, I might be able to do it, or I might be able to do it at a certain time. So there was a cost anxious group. Obviously, that's a little bit bigger in some of the lower socioeconomic groups. There's a group of system distrusters, and these are, again, we see this in some of the minority populations where they say, hey, the healthcare system doesn't treat us fairly. We're at a disadvantage. Why should we trust what people are saying? And then there's a group of people that are just COVID skeptics. They don't think that COVID's that serious. They don't think it's deadly. They don't see the issues with it. And I think in this article, from what I remember, Nevada was one of the states that they talk about that we had a high rate of that last group of the COVID skeptics. So, and again, this was a really good article that was in British Medical Journal, just talking about, what are some of the drivers of low confidence. And it kind of gets back to that New York Times article. There are some, history of some structural racism, unethical research. Those are all things that we need to think about. A lot of the misinformation on social media that we all see. But then obviously there's been barriers to access and getting some of those things across. So, I think one of the things that we're seeing in Nevada that's really helping is we're doing a much better job of getting vaccine to the people and not people to the vaccine. And some of the door-to-door things, some of the, pop-up vaccine clinics where you have vaccine there and you hit people, they don't have to take time out of their schedule. They don't have to go somewhere. I think have been really, really effective. Again, sort of a long list of why, we see low uptick or low uptake of COVID vaccines in the public. I think these are all things that we've heard. So I don't want to go through too, but how fast the vaccines were developed, younger people, hey, I'm not as at risk of developing severe COVID, some practical concerns. A lot of people, I will say, one of the things that people who have had COVID, it's a little different conversation in my office when I talk to them about getting vaccinated. The good news is we're making progress. This is like a Gallup poll. They went back to July of last year, saying if a vaccine was approved, would you get it? And we are seeing basically more and more Americans are wanting to get vaccinated. This was some vaccine hesitancy data. The top line is, what percentage of people were vaccine hesitant? And again, when that was in October 2020, that was up about 46%, 47%, and that dropped down to about 35%. So we are seeing a little bit more trust. Obviously, there's a lot of data about, and this is from the Kaiser Foundation, some interesting graphs about, vaccine enthusiasm. And, really by their data, there was about 15% of the folks who just were like, we're not getting vaccinated. We don't care if it's mandated. But there is some groups, one of the things I'm kind of encouraged about is that, with this study, there was about 9% of people that were like, hey, if I have to get this, if it's required, I'll get vaccinated. So I'm kind of hoping as we start to hit those numbers, and then that 39% group of wait and see how we're working. I am seeing more and more people now, and especially with Delta, who are like, okay, I have more confidence in the vaccine. It's been out a little bit longer. Delta's starting to scare me. Let's get vaccinated. And again, this is data that's been going around for a while, but most people trust physicians. I mean, one of the good things is about 85% of people look at their doctor or healthcare provider as the most trusted source of vaccine information. Now, I will say the downside to that is, for me in my office, that means 15% of my patients trust someone else other than me. And that's about what I'm finding. We find most of my patients, you talk to them about the vaccine, they're vaccinated, they trust me on it. But, every day out of 20 patients, I probably have 2 or 3 that, hey doc, I read something else and you're a great doc, but I'm going to trust, something I read on the internet more than they trust me. This is some data from Nevada. So we have seen, again, some nice increases in people wanting to get vaccinated. This data is a little bit older now, but in the 55 plus group, we saw some big upticks. We also fortunately saw some upticks again. We really understood some of the hesitancy and some of the minority populations, the Black population, Hispanic population. And I think with a lot of the work that Immunize Nevada has been doing and a lot of our public health things, a lot of our outreach in our communities, I got to give a lot of credit to some of our leaders in the Hispanic population and the Black population for getting people to trust them. And I think that's really helped out quite a bit. And so, again, we just need to kind of keep working. And we knew that this was going to be a really difficult thing to overcome. Anybody who's been doing vaccines for a long time knew vaccine hesitancy and anti-vaccination sentiment was going to be really tough. But I think it's just going to be, continuing to try to work, offering communications, trying to partner with organizations. Again, I mean, one of the things that's been really powerful for me is working with some of the pastors at some of the Black churches. The people in the churches, they don't necessarily trust me. I get that. I understand that. But their pastors trust me and they trust their pastors. So I think really trying to work with community champions, faith leaders, and really trying to come together is what we need to do to kind of continue to try to improve this. On an individual level, I tell people, when I'm seeing patients, I think a lot of us as physicians have been trained in what we call motivational interviewing, kind of talking to people about what their goals are, what their medical goals are, what they want. And just kind of trying to avoid arguments and rolling with resistance. I keep talking at a community level. I still don't know what the motivational, what the equivalent of motivational interviewing is at a community level, but we're working on it. So again, these are some of the things that we just kind of, I think, continue to need to work on. I think scientific literacy, we need to work on all levels, explaining to people how the vaccines work, why they work. I think we need to try to depoliticize things as much as possible. I know that's really hard these days. Everything's political. But I think as much as we can, we need to just focus on the public health efforts, figure out good ways of using social media to promote accurate information. And then I think the hard thing, and this is really hard, is trying to teach people what's a legitimate source and what's a not legitimate source. And I think that, again, that's been an uphill battle that we've been facing with vaccines for, is really as long as the internet's been out. So, and I always finish with this slide. This is a slide of all my friends in healthcare getting vaccinated. And I always end with this one because it's one of the things I try to talk to my patients about is, we would not do this to ourselves if we didn't trust the vaccine. We looked at the risks, we looked at the benefits, and, we're all willing to roll up our sleeve, get vaccinated. And so I think, just trying to get that message across that we're in the community, we're here to help people is kind of what's important. So with that, if there are some questions, I will take some questions. And I think we have to put Q&A or put questions in the Q&A if people want to write there, not in the chat.
Andy, so far there's no questions posted.
Okay.
I would encourage.
I must have covered everything.
Question.
Hey, don't ask me about the vaccine updates yet. I'm still learning. I still got to learn that stuff. So.
Oh, there's a raised hand.
Okay.
I think you can unmute yourself, the person that has the raised hand. Let's try that. Does that work?
Or can you type in the Q&A?
Oh,
Or someone
he's
type in the
typing
chat?
Yeah, he's
Nope.
typing in the chat.
Okay.
Maybe.
Maybe. You would figure after this long with Zoom, we'd have this figured out, but.
That was a great question. Kevin, maybe can you just type your question in the chat? Sorry.
Yeah, you may not have unmute. Yeah, sometimes with these Zooms.
Okay, so Andy, first question, would you advise school districts to mandate vaccines at this point or wait for full FDA approval or some other metric?
I think if you're talking K through 12, I really think that you're going to have to wait for full FDA approval for kids, which I think is still going to be a while. I think in the college population, that's a little different story. I think the amount of uproar while it's still under an EUA, while we're still, I think the vaccines are safe for kids. I mean, I think that we are getting good data with that, but I just think that until we have a full FDA approval, we need. I think sometimes if we push too hard, that could be bad for us in the long run. So I think at this point we'll probably see most of the school districts kind of hold off. There may be some there may be some ways that they can promote the kids getting vaccinated. I know that there's been some talk of maybe change if kids are vaccinated, maybe if there is an exposure that would change some of the quarantine rules and stuff like that. I have to admit, I can't keep straight what every school district's doing, and I think they all have slightly different rules. But I think at this point, to mandate vaccines, it's really going to have to wait for full approval in kids. So we need more information regarding severe disease amongst the unvaccinated. Yeah, I mean, I think that's something that, obviously with some of the data that's come out now, where we're seeing people still get who have gotten vaccinated get sick, or excuse me, people who are vaccinated getting COVID. I think that's, last week, that was for those of us who have been promoting vaccines on social media and doing stuff. It was a tough couple of days there. I think what we're really seeing now that I think is still pushing people, that we're all really trying to promote, is that idea of, the people who are getting sick, the people who are ending up in the hospital, the people who are ending up in the ICUs are pretty much the unvaccinated. I mean, we still do see a few people here and there who are vaccinated who get sick, but the vast majority of people who are getting this are the unvaccinated. So I think that's something, even with Delta, that's something I think that we're really going to have to try to push and talk to people about. And there is really good data pointing to that. I mean, some of the data out of San Diego and some of the other states, I think we're seeing that. And I think we're starting to see some of that similar data here in Nevada. So I know that's one thing that we've really been kind of pushing. All right. Well, with that, I don't see a lot of other questions, but I just want to thank Immunize Nevada and Heidi for sponsoring this, and I just encourage all of you to go out and talk to people. Let's try to get the word out there, talking to people, and we'll go from there. So thanks, everybody.
Thank you, Andy. Have a great night.